This is Mood, Menopause, and Mojo. Two docs, real talk, sparks included, because the rest of your life deserves fireworks too. So, why does my changing body mess with my confidence so much, even when I know it's normal?
In society, we're taught that a young, youthful body is what's worthy, and that's what is attractive. So intellectually, we can know that yes, we're going to get older and we're going to look different. When it happens, it's like, boom, oh boy, I wasn't really expecting this. I intellectually knew it was going to happen, but I wasn't really expecting it to look this way or to feel this way. No one really sets us up to understand what that's like. We don't have a sense of, from women or elders passing down the wisdom. Like in some other societies, there might be a bit of that, of the passing down of a wisdom of the crone and getting older, and that it's an okay thing to step into, and that there's beauty in that. I think in our society, it's like you're pushed aside, that you don't matter as much, that you're not as worthy. These are some of the messages that are ingrained. And so we really have to work hard to push against those messages and to recognize our own worth and our own experience and our own wisdom. And actually, I find that for many women too, sexually, though we may not respond exactly the same way and the same speed as when we were younger, it's like now we know our bodies more, and we can really tune into all the different ways they can feel sensual and sexual. And for many women, they can start feeling a little more confident in knowing themselves. Like we may not feel confident in the traditional way like we used to, like I look a certain way and I have this youth, but maybe it's more of a confidence in knowing like, yeah, I can speak up for myself and I can tune into what I want and I can know these things and tell my partner. And for a lot of women, I actually even see that they'll say, I kind of don't care as much anymore about what people say. So it's a different kind of wisdom and different kind of narrative we can step into if we're available for it. What's your
So,
experience with this?
yeah, so I have a very different experience with this, I think, but I also love what you're talking about with confidence because when I address this with my patients, a lot of times what I'm looking at is medical health. So changing bodies in midlife isn't just about like, oh, I've gained some weight or oh, I'm getting older. A lot of these things have implications for long-term health and that really gets me going. So a lot of the confidence that I see for people, it comes from a place of, I'm changing, but I'm focusing on other things. So yeah, you're not going to look younger or change a lot of the things that will kind of wind back the clock necessarily, but perhaps doing more weightlifting, which is really important to build strength. So focusing on health and being strong instead of being thin and running
Hmm.
on the elliptical every day. So some of
Hmm.
those kinds of transitions, knowing that you're taking care of your body in such a way that you're not going to fall and break a hip and, be laid up in a wheelchair for a while. Like that kinds of stuff, it can be
Hmm.
really uncomfortable and that can definitely chip away at somebody's confidence. So, being pre-diabetic and facing the risk of maybe a type 2 diabetes
Mhm.
diagnosis, this is
Mhm.
the kind of
Mhm.
thing that can really shake people's confidence in a different way. And so that's the area where I want to go in and help people, not just with like, oh yeah, you don't look how you want. Not looking how you want may be showing us that you're going medically in a direction that could be really bad for you. And so maybe there are other things that we can focus on that will build your confidence in that way and also give you some extra help where you need it.
I really like the ideas you're talking about of building the confidence in these other areas. That certainly being able to be physically fit and taking care of yourself and feeling strong can absolutely boost your confidence and feeling like good in your body, strong in your body. And that can then translate to in your relationship and in your sex life. If you feel strong and confident in your body with the strength, with the muscles, like that can translate to, I feel like I want to bring that into my sex life and feel like that vibrant woman in that way. So it's great to have these things to build on to.
Awesome. Thanks for hanging out in the messy middle with us. Wherever you are, we'll meet you there with sparks, stories, and support. Want to meet the docs behind the mojo? Stick around.
I'm Dr. Kristen Zeising, and I'm a clinical psychologist and certified sex therapist. I work with individuals and couples who want to feel more connected, alive, and empowered in their relationships and in their bodies, especially during times of perimenopause and menopause transition.
I'm Dr. B, Jessica Beachkowski, a psychiatrist specialized in women's mental health. There's no one size fits all when it comes to hormones, mood, or libido. But when we stop pathologizing change and start getting curious about what's really going on biologically and emotionally, that's when healing begins. Your mind, your body, and your relationships all deserve attention, especially now. Thanks for watching. For more on psychiatry, sex therapy, and everything in between, visit us online because every woman deserves fireworks.